Hi, my name is Dr. Mike Evans, and today I'm wondering if more is better. Specifically, if more screening tests are better. I mean, it kind of makes sense. It's just a test, so it doesn't seem like there'd be a big downside. And it might pick up something early. So to explore this question, let's paint a picture. Say you've been going to a family doc or a GP for many years, and when they see you for an annual checkup, they do a whole bunch of tests. I should point out now that we're talking about screening, the kind of test we do when you're symptom-free. So if you did have symptoms, say a sudden onset of severe fatigue, or it hurts when you pee, or you have a strange lump, that is a different story, and we'd be much more likely to order tests to find out what's going on. I am also making the assumption you are average or low risk. So for example, if you've been on a chronic medication likely to cause osteoporosis, or if you have a strong family history of a disease, we might take a different course of action. I will link you to some online risk assessment tools below and at the end so that you can see where your own risk is at. So let's say your doc always tested your thyroid and your vitamin D levels, a chest x-ray, an ECG tracing for your heart, tested you for osteoporosis. Okay, now imagine you've moved and switched to a new doctor, and she or he doesn't order any of these screening tests. In fact, she doesn't even want you to come in for an annual, opting instead to invite you for a prevention visit every few years. So you might wonder, was my last doctor better? More thorough? What family docs will tell you is that we focus on the testing, but it's actually about the relationships. I know that sounds funny, but if you have a good relationship with your doc, this leads to screening that's more personalized, that takes into account your values, the science, and your own unique risk. The prevention is partly about the right screening, but the bigger game in town is you having healthy behaviors and partnering with you to make positive change in your life. I love the opportunity to just focus on prevention with my patients. But like most family docs, I've shifted from blind annual testing on everybody towards custom strategies that consider your values and your individual risk factors, and encouraging healthy behaviors like moving more, healthy eating, helping people think better, and being opportunistic about making positive change. So is your new family doc okay? I would say so. By less testing, she or he is likely improving your health and applying science not only to treatment, but to prevention. Like a lot of things in life, when we think about it, more isn't always better. Better communication and knowing yourself allow you to choose a little more wisely. Hope this helps.